Homelessness is worsening over time.
If you don't have a home, you really can't focus on other parts of your life.
Our children are our future because we are the present.
You're one really bad day away from being homeless.
Folks that you walk past on the street, they're somebody's family member.
Housing, education, people. Those are game changers. We have the money, the intellect, the passion. We can do this.
Hi, my name is Hannon, and I'm the host of The Bells I Hear, an audio and video podcast that aims to raise awareness about the homelessness crisis in New York City and the complexity surrounding the issue. Thanks so much for tuning in. So today we have Shane Peacocks joining us. He has a decade of experience working with street housing, permanent housing, and government administration. Shane, it's such a pleasure to have you on today.
Thank you. It's a pleasure to be here.
Yeah, we would love to get to know you and hear about it in your own words. You know, what is your journey and what led you into working with homeless populations?
No, absolutely. As with most, it was a circuitous journey, I'd say. I didn't intend initially at the start of my career to work with homeless or street homelessness. I started out at ACS doing child protection. I realized I didn't necessarily want to be a clinician. I moved over to what I thought would lead to more kind of academic, abstract systems work. I started working in Section 8 in Boston and Baltimore. And then just through a chance opportunity, I came to New York and started working with the street outreach right at 2007, right when the city made a major change in their approach to street homelessness. Something got a hold of me and I've really not been able to shake it since. I've tried to do other things, and to be totally honest with you, it hasn't really worked. So I don't really know why. I can't imagine myself working in any other space than with street homelessness. What I think has really captured me is there's nothing left but honesty in this. It is so brutal and so tragic. I mean, you're certainly moved by the injustice, but it demands something of you, an authenticity and honesty that is very hard to achieve. Often people say in street homelessness, it's about meeting clients where they're at. And often that gets portrayed as sort of being non-judgmental and relativistic. And I certainly think there's an element to that, but I don't think that quite captures it. I think when you're dealing with people who are on the street, who've been traumatized and marginalized and all the issues which we will get into, it's not really about the judgment. They sort of expect you, you know, lives are complicated. Their pathways to the street are complicated. It's messy. Broken souls, and they'll probably admit a lot of people, they've done some breaking, and it is very tragic, and your judgment is sort of irrelevant. They expect you to be judgmental. What they don't want you to do is to pretend. They don't need you to pretend. What they need you to be is there for them.
Yeah.
And there's an element of unconditionality that I haven't found in any other service sector. A lot of other services are based on criteria. They're based on eligibility. I will help you insofar as you're willing to get help, insofar as you want help. If you are sane enough to know that you are not sane, if you are well enough to know that you are not well, if you have learned how to learn, I will help you learn. With homelessness, they need to know that you accept and acknowledge the condition, the history, the situation, and you are still there. And that is what it's about, you being there. And it's about having a respect for the person, for the inherent dignity, to be able to see possibility beyond what the present situation is. And just to go on, I mean, I'll end it with this. You know, there's also sort of a selfish aspect to it. I tend to approach these things from a bit more of an analytical, maybe kind of quasi-academic, high 5,000 point view. It's a dark vantage, to look upon the rest of society. Homelessness is about nothing working. Every system is a homelessness system. And when you're dealing with people on the street, you're dealing with ways in which those systems did not work. And it gives you a vantage into the nature of those systems at the most fundamental, elemental ways they operate. And it can be a little bit dark, but from there, it's, you know, that truth and that honesty and that ability to be unconditional is really what it's about. Finding a pathway out of that is sort of the key. You have respect enough to think there's better possible. I tend to approach things a bit more analytically, perhaps kind of quasi-academically. It gives you insight and advantage into other systems. All other systems are homeless systems. And street homelessness is about all of those systems failing. And everybody is implicated. And it demands an honesty. And there's nothing to be, again, but brutally honest about that situation. And again, it demands things of yourself. Often you hear podcasts and meeting starts, and everyone always says, what does home mean to you? And people say, oh, it means safety and stability. On the street, home is what you won't share. You will give me the food in your hand. You will give me the money in your wallet. Maybe you'll give me the clothes on your back. But you are not necessarily sharing what you have. You have a home. And what I'm saying is it requires you to be able to operate in the space of tension. And to be able to still operate in that space and have a relationship with someone means you need to come to a place where you know what you're doing and you accept it and you accept them and you accept the attention and you accept the problematic nature of it. And you're able to get past that and operate in a space of unconditionality, where the help is detached from all that and you are there to help no matter what. No matter what the condition, what the situation, no matter what you did, no matter what I did, anything, it is about you and me in the moment helping. So that's some of the reasons why I've been sort of taken with it, and I haven't found that anywhere else. And it's unfortunately an increasing problem. Homelessness is a growth industry, as they say. Unfortunately, it's terrible.
Right. Yeah, it is a system that, seems to be designed to fail. Like, obviously, problem is getting worse there. So what I wanted to ask you is where primarily are you working, or where did you start working?
Yeah, so I started working in the Brooklyn, Queens area doing homelessness. When the city changed the way they approached it, they sort of consolidated all the homeless outreach, all the programs prior to 2007. I think crudely, broadly, you'd say there were a lot of groups out there, a lot of offers of help, a lot of blankets and a lot of coffee and a lot of rides to shelter and detox, but the system wasn't operating as a whole. And then the city moved over to consolidating the homeless outreach system. So they gave out what borough-based contracts. So they hired nonprofits to operate in boroughs, and they were responsible in those boroughs for knowing everybody who they believed to be or receive reports about being or know to be street homeless, and then to work through the process with them and really focus on the most vulnerable among those people. The approach was less, to put it crudely, less making you comfortable on the street and more about connecting you to services. I'll bring the services to you. I will bring the nurse practitioners. I will bring the psychiatrists. We will do the paperwork under the bridge in the rain if that's what it takes. Whatever you need, we will do it here and now, and I will try to get you connected off the street. If you are hungry and you need assistance, I will bring you somewhere now to get connected. It is not about me giving you coffee, making you okay right now. It's about getting you connected. And the idea was permanent housing, and with that came a lot of different, the emergence and the kind of proliferation of supportive housing sites and development of safe havens and lots of different approaches that flowed from that fundamental approach. I'm bringing services to people.
Are you still primarily sticking to Brooklyn, or have you expanded into different boroughs, different areas?
Right now I'm doing a little bit of larger scale work. I'm working in New Jersey, kind of state level work, and then also in the city as well, kind of city-wide work, a little bit more of the kind of systems level work right now, and less specific outreach, less client contact.
Yeah. So do you typically, I guess when you are engaging with people that are on the streets, do you ask them what they need, like what kind of services they would need, or do you sort of like present options? Like, how does that process work?
It's a very good question. I think it's more of the former, but I think it needs to be the latter. And I can certainly get into why that is. I think, yes, you are absolutely asking people what they need, and you are trying to assess what they need. And I think some of the holes are we don't in the moment have connections to what's available to them. When you're meeting with somebody, you need to know who they are, what they need, and how you get them connected to it. And I think the how you get connected to it is an issue. And I can certainly get into a whole systems analysis of that. So often if somebody says, I need permanent housing, well, you obviously can't offer permanent housing on the spot. You might not even be able to, unfortunately, offer placement, and there's a process to it. And we can go through what that looks like and why not that might be an issue. But I think there's some approaches to engagement where it really has to be about offering concrete things. You meet as many needs as possible in the moment, and you really need to have something tangible and concrete to offer people in real time. And that the relationships, while sympathy and compassion and empathy are important, they are fundamentally based on being effective. And what people on the street need to know is that you can offer them help and you can do what you say you can do.
It's like you kind of want to build and establish trust with them and fulfill on like the promises that you're making.
And that trust really needs to come with you being effective. You being compassionate is certainly important, but I think what often happens is people do not have the tools they need when they're engaging people to be able to offer them the resources that are available to them. And homelessness is about time and it's about moments of yes. If you can't respond to that,
Yeah.
then you lose those opportunities.
So when you're going out in the streets, are you working with a team?
Yeah, so generally the way the outreach works is usually you're always operating in pairs. So there's always two people. A lot of these are borough-based teams that are operating in the city right now, although even within the boroughs, sometimes you have certain catchment areas or certain zones. I may be working in North Brooklyn, somebody may be working in South Brooklyn. The idea being you really know the area, you know the people, you know the dynamics, you know what the needs are, you've engaged everybody, and it's really, you're at the point where you're really working to establish relationships with individuals and checking on them. Assessing them. So absolutely. Now, I am absolutely in favor of where the field is going, and certainly I know there's resource issues, into very multidisciplinary teams of clinicians and peers, and sometimes police, or at least they need to be integrated in the strategy of who you're engaging and when and how, and just so you're all on the same page as to what needs to happen. But a lot of multidisciplinary teams, again, to be able to engage people in a lot of different ways in the moment and try to do it in as close to real time as possible.
No, it's great to have people from different backgrounds within different roles lending a hand to help out. And that makes sense. Like you're wanting to frequent the same areas, you want to build sort of rapport with people in the community so they know that like, hey, this is Shane, like he can be trusted. It's not like a new random person every time. So yeah, that makes sense.
Consistency is absolutely key.
So in your experience, what have been some of the biggest challenges that you and your team have faced in engaging and transitioning individuals from street homelessness into stable housing?
Absolutely. I can explain this a little bit. I'll go big picture and go down if that works. Fundamentally, street homelessness is a crisis. It is a manifestation of crisis. It is crisis. And I would actually expand that a bit to account for all street level activity. Panhandling, acute episodes of mental illness, public drug use, people who are marginally housed and floating around, even people who are kind of deep in the throes of asphyxiating poverty. I would actually jettison the notion of homelessness and reorient the service sector to assess individuals on a continuum of crisis. Now, housing is fundamental to stability. I recognize that housing, the material state of not having a place to go, a house, is certainly a factor, an essential factor in all of these issues and all these conditions, but I don't think it is the essential factor. I think street is crisis because what's happening on the street, I think, is a kind of chaotically complex interrelation of a set of needs and issues that essentially is forming a trap. And when people in traps, traps close on you when you try to free yourselves from them. When you are in a trap, you cannot necessarily address what got you there or what keeps you there. Symptoms become causes. Fundamentally, surviving becomes antithetical to thriving. The problem is we're treating this as a problem, but traps are fundamentally immune to linear problem-solving processes. But that is our approach. That is the way our systems operate. So we have these large systems. Systems are fundamentally abstractions. They are, policies and procedures and criteria and eligibility and compliance frameworks, and they are built upon a fundamental assumption. That assumption is that there is a causal connection between needs and services. And if I can just narrowly define the need and then tailor the right service and make that connection, we will be pulled in a direction of progress. And the more efficiently I can make that connection, the farther we will go. But these assumptions separate the systems from the very reality they are trying to address. Fundamentally, this is not the way change operates. Change when you're in crisis is nonlinear. It is non-sequential, as we sort of gotten to earlier. Homelessness is about the moment. When someone says yes, you can think of it in terms of alcoholism or drug abuse. You do not know if it's the 17th day or the 3rd day. Yes is going to lead to help and sobriety. You do not know if that relapse is going to reaffirm their commitment to sobriety or if it's going to set them off in a new trajectory. So when someone says yes, you have that moment. The only thing that matters is, do you have what you need, when you need, and are you able to use it in the way you need? And if you're coming from a systems approach where the system is the pathway through which you're addressing this, that's not what you have. In a system, a person in need and the help is over here, and between them is this set of abstractions. What's you need to be able to do is you need the resources and tools to be able to respond in a human way to a human situation with very concrete choices. Your choice is the intervention. You are respecting their dignity and autonomy, and you're coming to them with choice and giving them something very concrete that kind of changes the dynamic on the street, upsets the conditions, and gives them something to hold to pull them out. And this is exactly what the systems cannot do. Systems cannot respond to crisis. Systems are the wrong approach to the complexity of crisis. Because what you fundamentally need is you need systems to be acting unsystematically. Okay? And that just can't happen. Every year it's, we have the model to end all models. We have systems change and systems transformation. You can transform systems to the ends of innovation. Fundamentally, you cannot, when you have a system acting unsystematically, it's no longer a system. The model to end all models is no model. So that means you need a new approach to this. And I think this gets at kind of the core paradox that really roils the field and causes a lot of tension. Whereas, I can hear a lot of people, and I hear myself. What do you mean? We're doing lots of good things. Transformations are happening every day. There's lots of people holding up keys. There's lots of people before and after pictures. We are doing a ton of work. What the mayor once said to me, and it has stuck with me, and I will get into the case perhaps of how he said it, but we are doing a lot of good things, but nothing is happening. Our success is based upon us selecting for a fit. We are selecting people who fit. That is the basis of our success. A systems approach fundamentally cannot address people who do not fit the system. That no matter how far out you expand the system, there's always going to be people who don't fit. On the street are people who didn't fit the system, for whom nothing worked. And what happens is they're referred out and essentially cast off. No one falls through the cracks. They are referred and bounced until they're kind of cast off and form this kind of social sediment at the bottom on the street. They are disowned through engineering. It is not a systems problem. Systems are the problem. And we need to fundamentally have this new approach. And, just one other way to think about it is pain. When you are on the street in crisis is fundamentally about pain. It's a situation where pain has kind of become a disease. It has engulfed the self. It has taken over your fundamental ability to function. And pain is about real time. If you have a broken leg and the answer is over there, help is the reward through a process, that's irrelevant. Housing that is far away is irrelevant to someone on the street. They need now. I think a system and an approach and programs, aside from being accountable to quality, need to be assessed on to what degree do the people on the front lines have access to resources, and do they have the space and responsibility and autonomy and freedom to use those resources in flexible ways to respond to the pain, to the people in need in real time. And that is it. Not adhering to abstract targets and criteria and following processes or thinking that you have the perfect platonic flow that is going to, bring about change. That is not the way it happens. Change is emergent. It emerges from conditions. And so, just what I would say is just to slice, I would almost suggest, and we've tried this a little bit, is the social service system needs to be a thin layer that operates like an emergency room. I would suggest that every field team, every system, every social service worker, everyone who's been touched, who the individuals have touched, every system need to be operating together in real time. I've called it, when I was at the city, we called it a command center. I'd perhaps move away from that language, but everybody around one table, 24/7, looking at the same data, the same reports, and strategizing together around how to engage everybody on this continuum of crisis. No more, they're homeless, I do mental health to B, you do mental health from C on, you do addiction, I don't do mental health. Again, it's all interrelated. And, when you try to categorize the uncategorizable, this is sort of what we get is these systems that are too complicated, and it's too complex to handle with the process flow. So everybody needs to be working together, and it needs to lead to a kind of proactive, strategic, intentional, intervention-based, maybe time-bound level of engagement with people in need. And just like a hospital cannot prevent you from getting sick, a hospital is there to respond to the complexity of your immediate pain. And you can deal with the referrals and the specialization after. So the second you become homeless, you need to be enveloped by this system. And you need to be looking at resources as tools. Separate out the help from the system. It's about unconditional access to resources to people who have resources and can use them flexibly. It doesn't mean you're entitled to everything all the time, but you are entitled to help, and you're being engaged by people who have access to using resources. And I can certainly get into other examples of what that looks like. But that's kind of the overall view. And so we don't have that, is the long and short of it, unfortunately. New York City, and I can certainly get into how it looks in other states. New York City, we have as I've been told by many people across the country, you have a wealth of resources. It is almost gaudy in New York City, as someone said to me recently. If you are homeless in Midtown, you are probably being engaged by 5, 6, 7, sometimes up to 10. If you begin counting outreach teams who don't have contracts with the city, you are being engaged by so many agencies, and they're sort of falling over each other, completely fragmented, no strategic alignment. And again, New York City is too big, too large, too many teams, too complex. This is not something you can do through a task force or a meeting or a spreadsheet. It needs to be fundamentally integrated. All these teams need to be fundamentally integrated into kind of one approach, the way an ER kind of fundamentally integrates everything else.
Yeah, you broke it down incredibly well. I think it can be difficult for some people to imagine maybe an alternative, because we have become so dependent and reliant on systems. Like that's all that we've ever known. So it would really take reimagining the way that we approach everything.
Although I should say the city has made some steps. I mean, street homelessness is where people have tried. So I think there's lots of people on the street who are saying, yeah, that is what we're trying day to day, safe havens. They're always trying to get it closer.
Yeah.
But the problem is the systems can't do it.
So you mentioned that like they'll try to build systems or models, right? A model of a model. Like systems still exist despite, time and time again, evidence showing that they aren't as effective for dealing with homelessness and dealing with many of the struggles that Americans face, right? Like poverty and such. Yeah. So why are people still advocating for systems, or why are they continuing to try to implement more of these models, these systems that, are probably, going to not end up benefiting people in the long run?
I think some of it is fear, and it entails absorbing a lot of risk.
Yeah.
You're giving a lot of people a lot of freedom to do a lot of things that are very hard to account for. There's lots of reasons, and I can hear everybody in New York City saying, in the name of efficiency, in the name of equity, in the name of allocating scarce resources, you need a systems-based approach. But what I would say is you need to flip that. Services need to be oriented towards a tool-based approach. We need to stop looking at resources as the rewards of a system, as the end products of process. Resources need to be able to be used as tools. And it would require a different kind of compliance framework. You'd be accountable to quality. You'd be accountable to different things. You'd be accountable to reductions versus just tallying up placements. I've spoken to others, some of the transitions, the way NYPD, for instance, it became, I don't know the exact timeline. They were no longer responsible for just tallying arrests. It was about reducing crime. And that became a much more kind of perhaps abstract, but it required them to take a very different strategic approach. Now, in terms of systems, though, I think the field is moving towards it. You hear a lot about deproceduralization. Abundance is a new word, and there's a lot of people looking at processes saying, why are these systems? How can we not design the things we need, that we know we need? Why is nothing affordable? Fundamentally, I think we haven't been able to try it. I think it requires a level, again, of responsibility. It requires a new framework. You would have to have people overseeing these programs, very familiar with them, and know what they are looking for, and to assess based on quality. It would be, analogous to a principal of a school who'd been a teacher. They know that grades are good. It's certainly a helpful indicator, but they sometimes are more a reflection of a process than the actual learning. And they need to be a skilled educator themselves to be able to understand the dynamics that come through emergence. There's no KPI, there's no set number, there's no I'm 5, not a 3, therefore I'm better. It is a complicated kind of level of analysis that they need to do, and they need to have a certain familiarity with it and a certain success. And it requires a little bit of judgment, which is a little bit more complicated than quantifying everything. I think the people are moving slowly towards it. Again, maybe some of this integration is the way, and certainly flexibility is a word you hear a lot, particularly in the housing space, and some of the integrated frameworks like I was referencing earlier. That is certainly a move towards it, and hopefully with some of this movement around deproceduralizing, looking at the processes anew. Like why do we need, why are voucher utilization rates so low at certain points in time? We have these vouchers, we can blame landlords, we can blame a lot of factors, but we're beginning to, in the field, look at how is our process impacting the failure, these low utilization rates? What are we doing wrong? So it certainly requires a reorientation. I would say we need to reorient from a systems-based to a tool-based approach. And again, that would require looking at things anew, definitely.
Yeah, I think it definitely would be worth it since the approach that we have been taking has not been very helpful, I think, but it probably would take a lot of effort, but it definitely would pay off in the long run. But I can see how it wouldn't be like the most appealing thing for people in power or people that are so used to systems-based approach.
No, I mean, one approach I can add is, the fundamental thing is this is not done in bad faith. But what has happened is we are abandoning people in pain to these systems. And I think if you begin to look at Elton Furls and some of the old work around collective efficacy and neighborhood efficacy, when you're looking at neighborhoods, when you're looking at successful communities, I think there's a million factors, but the key one seems to be when people are willing to intervene in the lives of children who are not their own. That is a kind of central indicator of a healthy, robust community. And what we've been able to do is we provide these systems. Again, no one's doing it in bad faith. It seems more efficient. It seems better, a higher level of care. I can't handle this. We need specialists. And so in good faith, they're doing this. But, I know you guys are involved in youth. To bring it back to youth, this became really apparent to me when dealing with youth who had been homeless. When I was at a permanent housing program that worked with formerly homeless youth and people at risk of being homeless, one of the things we found was that people there, I don't have the numbers in front of me, so I should be careful, but they on average, the number was 40. They had been in 40 different foster care placements. Now, I may be getting that number wrong, and again, I don't have the calculation, but either way, it was dozens upon dozens, and I believe the highest was 70. Now, these are kids who probably have been involved in foster care from birth, literally. But what you see in that process was probably no one was acting in bad faith. I mean, everyone was trying to do their best. Again, we're getting to this paradox with everybody. How can we have everybody trying to do so much good, and it's not bringing that about and is bringing worse outcomes? But what you fundamentally had was, again, it goes back to that unconditionality, I think, at root, and that would kind of, this approach has to be undergirded by that. What you had happen with them was not in this family, not in this foster care house, not in this juvenile detention facility, not in this school, not in this hospital, not in this foster home. And it was referred and referred and bounced and bounced and referred. Every one of those situations was probably somebody saying, look, I can't help you, I need more. But what happened was, when you talk about unconditionality, what they learned was that everything is completely conditional. The second you fail, you are gone. The second you do something wrong, you are gone. And what we learned in that situation was that these kids, they had never had the ability to fail and be loved. As we know, the foster care system, we know there's lots of dynamics. The foster care system, when you are in foster care or when you're in one of these situations, the system is your parent. The process is your parent. That's just unfortunate. You have foster parents. No disrespect to foster parents and everything, but when you're operating in this space, that system almost becomes your parent. And they are showing you that it is very conditional, and if you do not act the way you need to, you are gone and out. And so they need a fundamentally different approach that needs to be based on unconditionality and kind of to reinstill that there's more possible. And that the tool-based approach, I think, is how you do it. You cannot do it with systems. Again, systems inherently can't do that. So, I think taking it from when you're kind of taking an expansive, comprehensive, and this is why I say crisis view. Let's look at people in crisis. No more, people do not exist in categories. Let's stop believing we can model change. Change is an emergent factor. It's something that ensues, it cannot be pursued. Let's stop looking at change that way. And let's begin giving people who are engaging on the front lines the resources they need. One more example, if you were to talk to a skilled, saintly teacher, they would know the approach is no approach. Some kids need a pat in the head, some kids need a kick in the butt. What they probably need is some crazy combination of both. And only the most skilled practitioner whose skills have been honed over decades of experience and success and failures and learning would know how to do that. This is just, it's an art, not a science kind of test. And what if you were to ask them, what do you need? They do not need a lesson plan, because they would know if you'd ever, it's like the Glengarry Glen Ross play. If you'd ever done it a day in your life, you get by on your wits. these teachers get by. What they need is resources. They need the ability to use resources in the way they need them used. And for each kid, it's going to be fundamentally different. And those resources are everything. Not only books, it's all the way up to maybe you can do enforcement and not and detentions, and you decide and you have everything. Because a kid who, they understood algebra, but they can't get to geometry. It's not clicking. There is no direct linear pathway out of that process. And the real teachers know it, and they just need the resources to be able to address it. And I think moving more towards giving people at the front lines resources and judging those resources by how they are able to be used in real time is the key. And that's sort of how you slowly, fundamentally, probably from a neighborhood base, you kind of slowly move up that way. And again, it has to be comprehensive. It has to have everybody involved, and they have to be involved in the strategy. It's not just to have everybody involved to add their input, but it's about having one strategy, one approach. There may be a million, infinite number of different approaches, but everybody's on the same page about it.
I think, yeah, the example that you gave with the foster home, I think that's something that will linger in my mind. Because I think, as you mentioned, I mean, like, not only are they dealing with being unhoused and not having this safe, secure place that they can call home for a long period of time, but one little mistake or one error and it's like you're kicked out. It's like you're not given that grace. Whereas,
Yep.
and it's, yeah, so you kind of are in some ways kind of being tossed around, and I can't see that being beneficial or helpful for the kid in the long run, obviously. And so, yeah, that really helped paint the picture of like how awful, living within structured systems can be, and how like, yeah, a different approach definitely needs to be taken.
If you avoid the pain of these situations and you avoid people, this is fundamentally about people's pain.
Yeah.
And just knowing that every decisions happen in the gray, and there's no linear pathway out of it. Connections are not, there's no straight line to connections, and you just need to be able to build a system that can respond to that.
Right.
Maybe looking at it as a medical framework, looking at it as an ER. You don't go into the ER and they don't, separate you out. They don't say come back in 30 days. They try to address the immediate pain in the real term and then figure it out thereafter. But absolutely, the unconditionality is imperative and essential, and that needs to be the basis upon which you report it. You're not entitled to everything all the time. I get that there are resources, but there needs to be somebody there, no matter what the condition is, not waiting for you. The system as it's designed is waiting. The burden is on the client to meet the system, to rise up and to meet their standards. Your job is to help them, not to wait until they rise up to your ability to meet them. You do not wait until they are ready to change. You do not wait until they fit the criteria. That's like saying, I'll teach English, but first you have to read and then come to me. That's not the way it works. You need to be down there helping and, again, assess the system based on what kind of resources you have to respond in real time. Do you have what you need to address the pain in real time? If you don't, then that's how you look at systems, not how much money you spent, not programmatically. Again, we often just fund these things programmatically. We say, oh, there's a lot of people without jobs. I will fund a jobs program. But again, not looking at the way in which it's implemented. And I think there's certainly some movement, particularly with the abundance framework, around looking at implementation. I think there's sort of an acknowledgement that we write these laws. Our success is how much money we're spending, and we're looking at things from a very programmatic level, but we're sort of forgetting how they're implemented. I think calling attention to the implementation, you start from the implementation on up. And then accountability to quality, and there's a whole accountability framework and responsibility that goes along with that. But fundamentally, you need the freedom to do things, and you also need the responsibility to do them well and to bring about change.
Yeah, 100%. You'd mentioned that you work with youth, and so obviously, as they're going through the motions, I'm sure that it's probably hard for them to trust people. And so what strategies do you and your team use to effectively engage unhoused youth on the streets?
Yeah. Unhoused youth on the streets is very difficult. It's a very difficult phenomenon. They tend to blend in quite a bit. They do not want to be acknowledged as homeless sometimes. And, fundamentally, there's a level of respecting their autonomy, even if that means sometimes walking away. If someone says, no, not interested, then just in that level of respecting their autonomy, respecting their dignity, you walk away. Understand that this is not going to be, you are not going to save the world in one instance. This is a long game, and change, again, emerges. It's an emergent thing. It's not something you necessarily have control over. We do not know how to control change. If we did, this world would be very different. If we knew how to cultivate virtue, if we knew how to develop leadership, if we knew how to foster creativity, things would look a lot differently. Those are fundamentally mysterious to us. If we knew what the black box of insight inside someone's mental health really looked like, if we had any control over that, this would all be very different. So we need to first acknowledge that. And then you are engaging somebody, fundamentally leading with respect and dignity and that unconditionality I was saying. But I think fundamentally, again, compassion, sympathy, empathy, yes, they're all important. But the clients are not interested in you and your promises or what you hope or how you feel about them. They need help, and they need it in a very tangible way. Again, it's about pain in real time. I have a broken leg. I don't need your sympathy. I need you to help heal it. I need you to get me connected to a cast very quickly. So I think the system needs to be designed so that people have something very concrete to offer, something very formal, and you can begin the process of showing them that you can be effective, for lack of a better word. I think trust emerges as much from effectiveness, and I think, again, going back to what I said at the beginning, it's really, what makes it so difficult is also it's really based on authenticity, and that is a very hard thing to do, to be authentic in this space. When I look at the old outreach teams, when I look at best earners, so to speak, people who are the most successful, I'm thinking of two people in particular I will mention, but they had wildly different approaches, wildly divergent temperaments, dispositions, ways of engaging people. One was very business oriented. I don't even know if they liked the clients. They were busy. They were, my job is to house you. I am going to house you, and you are going to be housed. And that is like the bottom line. Like me or not, sympathy or not, that's what I'm here to do, and that's what I'm going to do. And the other approach certainly was housing focused, but it was a bit more almost maternal, different kind of engagement. But fundamentally, what made them so successful, even though on the exterior they were radically different, is they were both so fundamentally authentic and true and honest. And clients pick up on that. They do not need you to pretend everything's okay. They do not need you to pretend that their sympathy matters or that they really feel the promises they're offering are real. They need help, and they need you to be able to offer the help you say you can offer, and that is it. And so I think what the system, when we send people out blind and we send them out without those details, when they don't know who they're engaging, when they don't know what they need, and they don't have access to anything or don't know how they'll access it, then it becomes problematic. Again, when you are operating from a systems framework, if between a person in need and the help is this criteria, you're always missing the problem. And when you are missing the problem, you are missing opportunities. And when you're missing opportunities, people are staying on the street longer. And so, when you're teaching, when people are engaging it, you just have to know there's no script, there's no approach. You have to learn your way to it, which means you have to fail your way to it. It is very hard. And again, I spoke earlier about the tension inherent in it, and it can be very uncomfortable and it can be very dark. It can also be amazing watching transformations happen, but fundamentally, I think what you need to do, a system would need, is to give people resources. When they're engaging somebody, they need to be able to offer them something. And I've moved a bit on this. Early on, I probably wouldn't have emphasized this as much, but I've come to emphasize it a lot more. Something very concrete and tangible needs to be the basis of our relationship to show that I can be effective and I can help you. Because again, they've been told people are going to help them a million other ways. They've been told these promises. You are not the first person to say this to them. And again, if you were in Midtown, you're probably not the first person that day. You're probably the fourth person before lunch to offer them something. And it really is about, what are you offering? What is the tangible, concrete thing that they can hold on to, that you can help? And, if you're waiting for a system, you're waiting for that something to spark alone. You're waiting for change to happen, for them to just mystically, magically change and come to you. And you just really need to be there. And sometimes it requires waiting. Sometimes it requires walking away. Sometimes it requires time. I recognize that there's a whole other dimension to this, which is public pressures and safety and move towards criminalization. But I think a really fundamentally integrated way of approaching this, when you have everybody who's engaging a client together, coming up with a plan, saying, this is how we're going to engage Joe. This is sort of the plan for the week. This is what we're going to offer. This is when we're going to, this is who's going to do it, can help frame the work in a little bit better, and not just leave it up to an outreach worker trying to do the equivalent of a cold call on a Wednesday night.
I know earlier we were speaking about, building trust with people that are unhoused on the streets. Like, would you say that is like another way that you and your team try to build trust with youth?
Yeah. Yeah, the trust is, I mean, that is the basis for it. They have to trust that you are going to do what you're going to do when you say you're going to do it, and you're going to be there. You know, the transition from the streets into housing can be really problematic. It can be a difficult transition for some people. Sometimes it takes a lot of different tries and a lot of different attempts. Sometimes things go wrong. Sometimes clients are ambivalent. And what they need to know is that you are there for them and to help shepherd them, walk them, escort them, be there to support them in the way they need you to be. And I think really, you know, again, that flexibility is as you get more skilled at it, you figure out what people need and what they're asking for, and you can provide it. And it really is, that's where the base is. As long as you can continually provide something, I think that is something will spark, something will happen. But you need that engagement. You need that interaction. Change emerges from that. It is, again, not just a matter of, you want a house, here's a house. Everything should be good. You need a job, here's a job program. Like, it just doesn't work that cleanly. The trust is essential, and I think when you send people out blindly or when they don't have resources, it can really, you're just another person offering something that's been offered before that I don't think is going to happen. Living the belief that you think something else is possible is about how you show up and how you engage them and how you're there and what you come with. And the honesty and authenticity. You know, if you're afraid, be afraid. If you're nervous, be nervous. You're just human to human is the way you need to do it. And people respond to that. If they don't want, and they can smell it on you, and they can determine that fear from a mile away, and it can determine when you're faking it or when you're pretending or when you're not being truthful. And that can be a very difficult way of operating, a very uncomfortable way of operating, a very tense way of operating. It requires a lot of skill and a lot of commitment and dedication and learning to get there, to be able to do that.
Yeah, trust is fundamental. So when you and your team establish the trust and work with individuals on the street, I guess where do you kind of follow them on their journey to finding stable housing? Like, where in the process do you sort of, sort of back off and let them, take advantage of the resources and tools that you point them to?
No, it's a good question. It varies. You have to be flexible. Yes. So in New York City in particular, New York City outreach workers were with you the whole way. From that first engagement on a Friday night at 10 p.m. on a cold night, all the way till you are in permanent housing and beyond.
Beautiful.
We are with you. And if you need us with you, we are there for you. If you don't need us with you, we're still with you. We may not be up in your face about it, but we're available. Mm-hmm. So the goal is, and again, I can speak to places that are out in New York because there's going to be a lot of states that are saying, look, we don't even have shelters, or we have shelters without caseworkers. I mean, you're talking about a resource-rich environment. So in some cases, I'm talking about the ideal, and New York is very lucky in this respect. But when you're engaging people in New York City, you can always offer them shelter. So you do always have something semi. But we know that 9 times out of 10, the clients are going to say, nope, not interested in anything that resembles traditional shelter, institutional frameworks for a variety of reasons. Even though the shelters are moving into new realms, there are some beautiful, wonderful shelters out there. This is not the old armory in 1985. There are other options. The goal is, and the system is trying to move to it. I recognize it's just that transition over to a tool-based from a systems-based, not letting the system lead. Trying to get to a place where when you say yes, there is a referral framework, you can try to get somebody into something called transitional housing, which are safe havens, stabilization beds. And this is essentially a shelter system that is designed to work with people coming in from the street. It has different sets of rules, different approaches. You could theoretically come in and your name is John Doe or unknown, and the teams will accept that and work with you at your pace. And there are services on site to provide you what you need. Everything is sort of housing based. The idea being we're going to really work with you to get you into permanent housing because that's the ideal. And they certainly are connected to other programs and other issues may arise. Maybe your primary issue is addiction. And housing is certainly helpful, but really what in the short term you need is addiction help. The outreach teams are there the whole time. And especially if they've established that trust. The way it's set up is that there is an integration between a lot of these shelters, this transitional shelter network, and the outreach teams, where outreach teams may be there, they still may participate in case management and meetings. If the client trusts them, they can be there to help the client, to vouch for the site. If there's an issue, they can come in, and essentially they can also do transports and connect them to other services and just be a resource. Just the morning after that first night, for the outreach teams to have the freedom to just go and check, how you doing? Is there anything you need? What can I help with? That kind of thing. And then what's really essential that New York does, and particularly street outreach does, is aftercare. So that doesn't stop when you're in permanent housing, even though a lot of homeless individuals go into what's called supportive permanent housing, where there are services on site, sometimes medical services, mental health services, addiction services, just a whole panoply of services. Some of these sites are very rich in resources and very beautiful. But still, the outreach teams remain engaged. They still follow you for at least 6 months or so into it. And if you need more, they are there for more. And they're there to see if there are any issues. Make sure there's no evictions. Make sure you're not returning to the street. Or if you are returning to the street, they're making sure that the bed is still open and re-engaging you on the street and figuring out why. Or just being there to help with mundane things, setting up utilities, setting up phones. How do I get connected to this? I want a job program, whatever it is. So that unconditionality, that kind of consistency, that kind of support is really what is essential. It is non-conditional. It is not drop you off at school, goodbye, good luck, see you at the end of the day. It is we are there for you the entire time. And you cannot really do that well without trust. Some clients may not need it, they may not want it, and that's fine, but you're always there for it. So yeah, that is sort of essential. And again, it gets back to that kind of bouncing around and referred out. And, if it is undergirded by trust, undergirded by this consistent support that is human to human, then I think it can work a lot better. It's not just me being referred to another program. It's not you saying, I can't help you, somebody else can.
Yeah, it's kind of like a family that you can rely on, which is really important to have,
Exactly.
someone stable, someone that will be there through it all that you can rely on. And in previous conversations that we've had, that's important, to just have at least one person in your life that's, rooting for you, that is willing to help you whenever you need help.
No, again, I think it's tragic that we have to have programs step in and be family, and absolutely it's an indication of the situation we're in and the crisis we're in. I think that framework is really helpful, and I think it comes a little bit more on the youth side than on the adult services side, to be honest with you. I think there's a lot more attention to kind of the development nature of the work, that you might be dealing with high ACE scores, people coming in with lots of deficits, and trying to, you can look at it a lot of different ways, but that we are filling in gaps and trying to do some development, usher you through some periods of growth to help you kind of reintegrate into the world, so to speak, and gain some independence and ability to act on your own. And so clinically, it's a little bit of a different mindset, but I think a family mindset, when you're thinking in terms of growth and family support, it's not really about change, it's about growth. The change we actually want is about growth. And growth emerges from these conditions. It emerges from stability and support. It is not just change. And I think, again, one other way I can put it is there was an old Malcolm Gladwell formulation, which I really liked. And it's modeling agencies don't make you beautiful, they pick beautiful people. The Marines make you a Marine. They break you down and build you up into a Marine. And we have a lot of modeling agencies that think they're Marines. And they are selecting. It's sort of treatment versus selection effect. We think we are changing, we are looking at change as growth. What the Marines are interested in is growth and change, and that requires a different framework, different set of conditions. Again, it requires looking at the environment, knowing that what you have control over is the environment out of which the change will come and will emerge. Family dynamics are never solved. Those are uber complicated, and those are not solved in single instances or weeks or months or years. It's a very different view of how to engage people, what the aims are, and how to go about getting that. And so it can't be done systematically, linearly. It's art versus science, gardeners versus carpentry. These are some of the frameworks.
Yeah, you're really painting the picture of how we need to implement new frameworks, new ways of thinking. So in your experience with working with youth on the streets, how do you support them in sort of reconnecting with school or education, at least for the ones that are interested in doing that?
It's hard because if the education is just another system that failed them, it's very hard to get them integrated in. And what we're looking at, and I obviously, you can probably tell I'm coming from a very kind of Waldorf, Reggio, Montessori school view of schools, that it's an institutional framework from like a 19th century industrial view of the world. And that schools fundamentally, there is room for them to be changed in how they operate at the most fundamental level. And so I think the problem connecting youth to school would be the same problems that we've been talking about the entire time. Is if you're on the street, you're in survival mode. That is not conducive to learning or to going through the process. And even if you can help them, the fact that they're between them, even if they indicate a desire or willingness to go into school, let's say from the street. What that's going to take, all the processes, procedures, criteria, eligibility, is going to be problematic. Even with the highest levels of support, it's probably going to be difficult from the street. And I'd ask, really, I'd kind of put it on the schools. And again, you'd go back to those amazing, wonderful teachers who are doing the work and who want to work with that population. What do you need? What kind of environment do you need? What kind of school setting do you need? What kind of organization to the day do you need? I mean, I think schools, perhaps a separate podcast, but schools are like hubs of neighborhoods. I think they're a way a lot of parents get in touch with systems. Schools should be like full-scale drop-in centers. There should be every service available should be at these schools. Obviously we know a lot of kids get their food at school, get the majority of their nutrition from schools. And when parents show up, they should also be able to be connected to every system. Schools can operate as much more than this kind of linear institutional model. But so I'd say it's very difficult. It's the same thing as connecting the youth to any program that's not built for them. And it just requires a lot of pushing. So what you have as an outreach worker is a lot of your time is based on navigating systems, on managing process, and all the while trying to keep the support the client, keep their desire and interest up, keep that flame going. I'm working at it, but it requires a high degree of resourcefulness. Who to call, how to do it. They don't fit this procedure, but I need them there. They're not completely eligible for your program, but it would be perfect for them. I know it's the middle of the year and they're not eligible. They've never been in school. Like, how do I get them connected to educational resources? And that level of navigation is just really tough. And again, because the distance is the process, and that's the problem. So connecting people from the street is very hard. I think the prevailing notion of the key way is you just have to get them inside first. That goes without saying, perhaps, but I should just say it. The easiest way to do that is to get them off the street, out of that survival mode. Let's get you inside. Let's get you into a safe, secure, stable environment. And then it's a little bit easier to get you connected to those pathways. We have some breathing room, so to speak. But again, it's just back to the same core. These systems are not aligned. They are not built to absorb it. They are not built to fit. They are not operating like ERs that are prepared to accept complexity. They are prepared to accept certain people in certain conditions who can do certain things. And if you don't, then they don't have an answer for you. You got to find another one. And that's where it becomes problematic. And a place like New York, again, I would just say, because I know there's a place like New York that's very different, because even though there's a lot of issues, there's a lot of resources. In some states where I'm working in now, there's nothing. Case managers are doing this. Resourcefulness is like number one. Scrappy resourcefulness and a kind of PhD level of complex systems that do not interact is required for frontline case managers, because these systems are completely unavailable. And so if you're in a region that doesn't even have shelters, doesn't even have many of these networks, it takes a lot of work to get somebody connected. And I think that's where you lose people. The streets are very dangerous. Again, these are not good environments. The dynamics every day get worse and worse and worse. That trap gets tighter, tighter, tighter. People can get accustomed, and they develop adaptations that allow them to survive on the street that are very problematic outside the street. And you're dealing with all these paradoxes. And so time is of the essence. And again, it is a human response to a human situation. Somebody is saying, I'm in pain. I need school, but what they are saying is, I need something. They are in pain. Just think of it in those terms. They are in pain, and how are you responding? And we don't equip people to be able to respond to that. We abandon them to these systems, and I think that's fundamentally. A youth on the street, somebody who's young on the street, you want to be able to give them whatever it is they say they need to come in. That's it. They can say, I don't know. You can go through the list of what they need. They need a job. They need education. They need a unit with a closed door, whatever the case is. Our responsibility is to provide the tools to the people in the front lines so that they can engage people in ways that they need to be engaged.
From what it sounds like, schools, they are another system. They don't really accommodate youth that are experiencing certain challenges in their lives. So I guess
I think they try. And I think there's saints, the teachers, and I know homelessness is emerging. I think the teachers probably know who are homeless. I mean, we see this across the country. Teachers know who's homeless way before the systems do, way before the outreach teams do. And I know there's tons of stories of closets, of gear and clothes and showers being installed in schools. They're becoming shelters in their own rights just to help homeless youth. So I think they're trying, but they're trying within that framework. Again, you need I'd love to know what the teachers, what do you need? You're serving this population. You know what it takes. What freedom do I need to give you? What resources do I need? What control over the schedule? What control over the flow of the day? But I think the fundamental dynamic applies to it. Giving those amazing teachers what they need to address this population and to work with the kids and deal with the issues they are seeing every day that they are forced to deal with within a very highly institutionalized, systematized framework.
Could you kind of explain, like, I guess the impact or how important it is for schools to be accommodating and to ensure, homeless students are getting their needs met? Like, I guess what are sort of like the positive outcomes that could occur?
No, I mean, I think it's, it sounds a little bit tragic, but you need to be able to absorb people's pain. I mean, you're dealing with people, these are issues that are manifestations of pain. And think of it like an ER can absorb all kinds of sickness, all kinds of pain, all kinds of issues. A teacher, if a kid is acting out, if a kid displays certain behavior, if they're coming in obviously homeless, what you're essentially saying to the school is, and to the teachers, and I think they would want this, is you need the ability to support, wrap yourself around it, absorb that, address it there on site in real time, as close to real time as possible. And that can mean a lot of different things. It can mean food and psych services and just the way the days are structured and the buildings are oriented. How you need to be able to address that in real time. You need the resources and you need the ability to use resources in flexible ways that you, as a skilled, successful, professional educator, know how to use them. Again, some kids it's a pat in the head, some it's, like I said, a kick in the butt, and you know that it's a crazy combination of both, and you know how to do it, and you need the resources and the support to do it, and you need the freedom and space to be able to operate it in the way you need to address it. So I think there's that. And I know, again, systems, when you're dealing with New York City, I don't know how many millions of children you're dealing with. When you reach a certain level, it becomes about social engineering. When you're dealing with 1 million kids, education becomes about crowd control. Medical becomes about numbers and things of that sort. And so I recognize the scale is a factor here and how you allocate scarce resources and organize your day. But I understand that that's the necessity, but I think it's the wrong necessity. What's of higher importance, the higher necessity is crisis and pain and emergency. And I think that is what we need. We need to stop looking at these things as needs and look at it as a crisis. We are in a crisis. Homelessness is beyond not having a home. It is fundamentally a crisis, and we need to address it as such, the way you address emergencies. And I know we sort of think we're doing that, but what I'm saying is we're not even close. And so the schools are an essential part of that. I would just say the key thing is they need the space and autonomy and freedom to be able to use the resources they have in the ways they know they need to use them. They know the neighborhoods. They know the dynamics. They know the parents. They know what needs to be done. They know how they can absorb a homeless student in the middle of a year. They know all these things, and they just are not able to do it.
Yeah, wholeheartedly agree. What strategies or how do you and your team approach the intersection of substance use and mental health for, mental health challenges for youth that are also on the street?
Yeah. Recognizing that with the youth on the streets, though, just youth in general, sometimes those mental health challenges, schizophrenic breaks or things, those are very scary. And to watch someone going through that very early in their life is really tragic and difficult. Again, separate out the help from the condition, from the issue. You are just there to help in whatever way possible. The help is not conditional on you. So a lot of the housing, particularly for the street in safe havens and things of that sort, it's very much on a harm reduction housing first model, which means you do not have to be sober. You do not have to be complying with medication to come inside. We will work with you to get there. But that standard is not at the door. We can help you reach that standard. It's our obligation to help you reach sobriety or address your mental health. But that is not the standard you need to maintain before coming inside, before getting the help. Help is not a reward. I think it just really is giving these sites tools they need to address these. I don't like the organization of, this is a mental health shelter, this is a job training center. I would rather, and again, setting aside resources, everyone should be equipped to deal with everything. Sometimes youth in particular, you may accept a youth and a couple years later, a couple months later, they do begin to have some breaks or issues arise. Once people come inside and kind of adrenaline goes, that survival mode goes away, a whole other set of issues sometimes arise. Sometimes it's family integration issues. Sometimes now they have to deal with what brought them to the street or what led them to the street, which is a whole other step. Housing is like step 3. Housing is not even the end. I mean, housing is the beginning of the start. So it really is about equipping the people at the front line with tools, with resources they can use. So in terms of mental health and substance use, you want to make sure these providers have the resources they need to deal with somebody who's using on-site. And that can go into very operational details around how bathrooms are structured, how security is structured, how the front doors are managed, around what kind of training, what kind of engagement, and room checks, and mental health. Do you have a clinician on site, or do you have clinicians coming in every other Thursday? What is the clinical approach? What does the lease say, and how many incidents are they allowed to have before they're asked to move? All these kind of operational frameworks. And I think all of that needs to be, the orientation for assessing those needs to be, to what degree can we use those as tools to engage people in the ways they need to be engaged, to help them stay, to provide the help they need. We not referring out, not moving along. How can we kind of operate with that unconditional help? So, what you'd ultimately want to say, if there are mental health issues or there are drug issues at a site, is, if there are, let's say it's in a negative way, let's say there's an issue, what you're fundamentally saying is, you can't do that, but I want you to stay. But you can't do that, but I want you to stay, and I will help you stay. And I am here to help you, and I will help you to stay, but you can't do that, but I want you to stay. And that kind of complicated dynamic. And then I need, as a program manager or the building director or whatever, I need the tools to be able to ensure I can provide that help and support. And I have it, and I can use them in the ways I need to be able to use them flexibly. People are going to need all kinds of different ways of engaging. It's like pots of petty cash almost. I'm trying to think of metaphors to indicate how it would be done. There is a degree of risk, there is a degree of change, but there has to be a degree of freedom. And with that freedom would come a lot of responsibility. And I think you'd have to start assessing programs very differently. And the burdens on them would be very high. The responsibility for an outreach team to make reductions, to stabilize units would come, but with that responsibility, your responsibility is to say, address these issues. But the system's responsibility is to make sure you have the tools to do so. What we have now is sort of an in-between. You're responsible for some things, and we don't provide you much help in getting there. And so we sort of meet in the middle. Messy, problematic, and as I've said, when the systems produce the crisis they are meant to address. And therefore you're always in this loop. We're doing good things, but nothing is happening. It's not the right approach.
I think something that you said that really ties it together is like help is not a reward. It's like fundamental. It's like bare minimum. The least that we can do is to help people and meet them where they're at.
Yeah, I think that unconditionality, and again, I want to iterate, it's hard. And it requires there's nothing left but honesty when you're engaging somebody on the street. And to get to that point is I don't want to say it's easy, and I don't want to be too dark about it. Lots of people I know would probably love if I was a bit less dark about these things, but it is very hard work, and it is that unconditionality is very rare. And I think what you see in homelessness field, particularly in street homelessness, is people sort of stay at it. There's some people who kind of respond to that, and there's something about it that I think it's very hard for people to kind of put into words. They remain in the field, they do not leave the field. They are just always there night after night, day after day, and that unconditionality, it's almost, spiritual or religious or secular version of that. It's a different way of operating. I accept, I acknowledge, and I believe that there are different possibilities, and I am here no matter what. I can handle it, and I'm here to help you.
Yeah, there's been a lot of fantastic takeaways. Unconditionality, you mentioned how systems aren't the end all be all. We have to sort of reimagine the way that we provide resources and tools to populations that need them, and how important it is to build trust with, unhoused people on the streets, also respecting their boundaries and responding to their needs, because you can't assume, what they need. Do you have any final thoughts or words for our audience, Shane?
There is a pathway out of the crisis
Yeah.
we're in, which is thinking of it as crisis, ironically. So thank you very much. It's been a wonderful conversation. And
It's been so great having you on. This has been such an amazing discussion. So thank you.
Thank you very much. Appreciate it.
Thank you for tuning in to today's episode. The episode was hosted by me, Hannah Nabraha, produced by Baron Mello. The audio and video editing was done by Ilona Tuominen, and the music is courtesy of Diego Urquela. If you enjoyed today's episode, be sure to subscribe to The Bells I Hear and follow us on social media at The Bells I Hear to find more content and to spread the word. Thanks again. Till next time.